Welcome. In this session, we're going to speak about the health of adolescents. By the time you finish this session, you should be able to define adolescence and speak about the special importance of adolescent health. Note the leading burdens of disease among adolescents. Comment on the risk factors for those burdens, and identify measures that can be taken to address some of the key burdens of adolescent health. Let's begin by defining adolescence. Yafet, what is an adolescent?
An adolescent is someone who is between ages 10 and 19 years
That's
old.
right. And everybody should understand that the data on adolescence is not very good. Sometimes people have data 10 to 19. Some organizations have data that's 10 to 24. Some have 10 to 14 and 15 to 19, which is really also helpful, as you'll see. But you have to understand there isn't easily available, always consistent data about 10 to 19-year-olds. And often that data is mixed with data for 20 to 24-year-olds who are more generally referred to as young adults. Now let's ask Rachel, why is it so important that we focus particular attention on the health of adolescents?
Well, there are a lot of reasons to focus on adolescent health. One, there are a large number of adolescents globally, especially in the developing world, and they face a health burden that's unique. Also, without protecting the health of adolescents, a lot of the progress that's been made in improving child health is lost. And adolescent health also lays the groundwork for healthy and productive lives as adults.
Very, very beautifully said. I am absolutely certain I couldn't say that so well myself. Let's explore adolescent health briefly through a few vignettes that illustrate some of the special features of adolescence and why it's so important to focus attention on them. David is a 17-year-old boy in Manila, the capital of the Philippines. He's in his last year of secondary school. David's a typical adolescent male, and he's regularly being exposed to the risks of tobacco, alcohol, substance abuse, and unsafe sex. Soon, he's going to add another risk when he learns to drive. David's family knows he's a good boy, but they're constantly worried about David's ability to manage adolescence in a healthy way. Graciela is a 16-year-old girl in San Salvador, the capital of El Salvador. She's constantly being exposed to the risks of adolescence as well. There's so-called junk food all around her, and an increasing number of her peers are overweight and obese. Some of her peers have also started to smoke tobacco. Others are also beginning to engage in sexual relations with young men in the community, often unprotected. Social and economic pressures have also caused many of her young female friends to feel unhappy, and often unhappy to the point where they can't fully function. We also have to ask if Graciela will be able to come out of adolescence as a healthy young adult. With these vignettes in mind, let's look at the 10 leading causes of adolescent death by sex for 2012. And here what we'll see, and remember this is 10 to 19, and we later are going to break this down into 10 to 14-year-olds and 15 and 19-year-olds. Here what we see is road injury as the leading cause of death among adolescents globally. What you see in red, not unanticipated, is males, and what you see in the blue is females. We also see HIV/AIDS as very, very important, usually for upper adolescents, as we'll see. We must never underestimate the importance of self-harm as a cause of death for adolescents. We still see pneumonia, lower respiratory infection, interpersonal violence, which is more important in some regions as others, as I'm going to comment on. Injuries like drowning that occur primarily among the younger group rather than among the older group. So it's really critical, if one is to think about the health of adolescents and how it is that their health can be improved, of course, that we think about what it is that adolescents are getting sick, disabled, and dying from. So let's look now at what this would be like if we looked at their health in terms of disability-adjusted life years rather than in terms of deaths. And here we see a pattern that's somewhat different, and also why it's so valuable to think beyond deaths and to also consider what it is that they're getting sick and disabled by. Here what we see, and also something that's extraordinarily important, is that the leading cause of disability-adjusted life years among adolescents of both sexes in 2012, among adolescents total, for both sexes in total, is actually unipolar depressive disorder. In fact, mental disorders are even more important than that, because we also see, as the 8th leading cause of disability-adjusted life years, anxiety disorders. Now, in addition, beyond what we saw in the last graphic on deaths, we see the exceptional importance of iron deficiency anemia. And we also begin to see, even for relatively young people, musculoskeletal disorders as well. So there are a number of takeaways from this, but one that I'd really like to encourage you to keep in mind is the truly exceptional importance of mental health issues related to adolescence. And in here, it's unipolar depressive disorder, self-harm, I should also have said, and anxiety disorders. Now, we would also expect, of course, for these conditions to vary by age group and by sex within those age groups as well. And in fact, we see that they do. Road traffic injuries are always more important, always, I think we could say, more important for males than they are for females. And yet here what we see for females is the exceptional importance of HIV/AIDS, which we're also going to talk further about. Here what we see, given that these are low and middle income countries, is in the younger group we continue to see some causes that are communicable: lower respiratory infections and diarrheal disease and malaria. As children get older, we still see malaria, but we see less communicable disease. They're older. Hopefully they're stronger. Hopefully they're thriving better. Hopefully they're better nourished as well. But as children get older, what we see is they face the risks now increasingly of road traffic injury, of interpersonal violence, and of self-harm, which for females 15 to 19 in low and middle income countries in this year was actually the leading cause of death. Okay? Here in this graphic, what we're going to look at is the leading causes of disability-adjusted life years globally by age group in 2010. The slide is divided into 4 different age groups: 5 to 9 children, young adolescents, upper adolescents, and young adults. There's a lot on this slide, so I'm just going to comment on a few things. Among the younger group, you would expect to see continuing deaths from and disability-adjusted life years due to some communicable diseases, as well as the beginning of DALYs and deaths that relate to exposure to accidents and injuries. And in fact, that's what we see. As we move along the life course, and as children go from 5 to 9 toward 15 to 19 and 20 to 24, what we see is a larger share of the total DALYs that are attributable to mental health disorders, to HIV/AIDS, as well as to road traffic injuries and interpersonal violence. And it's really important, again, if one wants to enhance the health of adolescents, to break adolescents down into different age groups, identify the causes of disability-adjusted life years and deaths in those age groups, the risk factors that relate to them, and then begin to decide what are the most appropriate, cost-effective measures that can be taken, hopefully in doable and sustainable ways, to help enable better health among adolescents.